What training advice would you give to someone with carpent compartmental, excuse me, arthritis in the knee joint? Yeah, any kind of arthritis, I try and identify the positions in the range of movement that is starting to be problematic. Wouldn't necessarily train somebody any different that had arthritis in the knee. I would just use limited ranges of movement or possibly isometrics to still work the muscles that innervate that joint, but do so in a way that in a position of the range of movement that doesn't cause that same degree of irritation. So you still want to train those muscles hard so the muscles release myokines and have a positive effect on the composition of that joint. That's how I would kind of handle the training part of it. If somebody, isometrics are really good, I think, in that regard. But probably the biggest thing I would look at with anybody that comes to me with any kind of autoimmune condition, arthritis, diet's usually the first thing I recommend. And unfortunately, having a personal training studio, it's one of the factors that I don't really have a control of. I don't really do phone consultations. I do, but it's not my favorite thing to do. But if you're looking for a way to very quickly improve a lot of inflammation, a lot of arthritic conditions, diet is number one. And there are training modalities that you can use around that, but I would have somebody drop their carbs as low as they can consistently adhere to, try and get quality of sleep, probably increase their water intake a little bit, do some grounding. And after making those recommendations, then I would kind of talk them through how I do things here in the studio. Probably wouldn't use any kind of like leg press, but we'd still do leg extensions, leg curls, like adduction and abduction. We would still do everything we could to try and articulate that particular joint that had that condition. We just want to do so in a way that doesn't naturally produce any kind of aggravation or irritation.